Hi everybody, my name is Camayah, and this is my priority health issues presentation on reducing maternal mortality rates in African American women. So, to start off with, our topic and our background of this topic is about Black women. And the issue here that we are trying to address is that Black women are 3 times more likely to die from pregnancy related complications than white women. This is because the United States has one of the lowest maternal mortality rates. For developed countries. This is common in developing countries, but as developed countries, the United States need to work more and better on making sure that our mothers are surviving and not having any complications during pregnancies. That's making this so significant is because of those complications in pregnancies, many more women are dying, and specifically Black women. And you can see this by being shown in the Healthy People 2030. They said that 22.3 maternal deaths were recorded per 100,000 live births in 2022. So that's pretty high compared to how many births that are going on. And so, one of the challenges that many Black women are facing is that they don't have access to affordable health care or health insurance. Many people aren't covered under Medicaid, and that can cause them not to be able to afford to go to the doctor's office or see their OBGYN as needed. And another challenge is that many women are unaware of the symptoms that come with complications for during birth, after birth, and before birth, like when you're trying to conceive as well. So, a few little facts that I saw and I used in my fact sheet was that the CDC had a chart that showed the different races and how they were affected by the maternal mortality rates in the United States in 2023. And obviously, with this graph that you guys can see over here, it has a large gaps between the races, especially between Black women and white women. And you can see that Black women are 58%, they have a 58% chance of not surviving during pregnancy. And on this side, one of the many websites that I looked at that offered free healthcare classes were the Healthcare Mothers and Healthcare Babies collaboration of Georgia. And this is a free pregnancy class program that allows you to get guidance and see how birth is and learn a lot in this educational class. And this is free for all expecting mothers, and shows them a little bit more about their postpartum journey, and they don't have to worry about paying out of pocket. So, some of the social media graphs that I had was this one over here that showed the risk, and it shows 5 risks that are a sign or a alert that mothers should be aware, especially because during postpartum you can have a lot of complications like hemorrhaging or um, like I was stating, there are many signs and risks that come with postpartum journey, and these are some signs that mothers can look out for so they can be aware and that they can know that they're trying to prevent any complications from their birth. On the statistics side, you guys can see again that I redid the survey that the CDC had and just showed in different variations and colors the 58% of Black mothers that had the maternal mortality rate and the 16% for the white mothers. Going on to the next slide for our social media graphics, we have our preventative tips over here. And this preventative tip is basically from the Health Resources and Services Administration, the HRSA. And this is a wonderful website that helps mothers in low income communities support and educate their families on how to protect themselves and care for their babies. So they learn about safe sleep, preventing SIDS, all of those categories. And this is also helping mothers in the low income community because they are getting access to the education that they need. And finally, for our social media graphics, we have our call to action. And this one right here states that it is really important to improve all of the postpartum mothers and their mental health stability. And as you can see, that sometimes having wellness checks and research evidence-based interventions can help prevent any of the long-term complications. I also provided the National Maternal Health line down here that is always on or online or always available for mothers. And these mental health hotlines can be used for all types of mental health illnesses. And also, just to reiterate for the prevention tips, we have a hashtag that many people are using and a link down there that you can use that can link to the website so you can learn some more information. So, some of the resources that I've used to research all of my information is starting off with the Healthy People 2030. This website helped me start my research in maternal mortality rates, and it helped me learn many quick facts and links to further research sites like the CDC and the March of Dimes website. And these are many websites that help low income families, Black maternal mothers, and infants as well. The HRSA, which again stands for the Health Resources and Service Administration, was another helpful website that helped me learn how to use a fact sheet properly for the assignment and also showed me what resources are available in the community that can help mothers in low-income communities. And it showed me the advantages that need to be taken for this health disparity, and it showed other free pregnancy classes, like I stated earlier. Lastly, the CDC was my most helpful online resource website. This was very helpful for me because I learned a lot of new information and statistics about maternal mortality rates in the United States and other countries as well. And it led me to the conclusion that there are many preventable pregnancy complications that are not being screened for. Like I said earlier in the fact sheet, there are 5 signs that many mothers can be made aware for, and they're not. And so, due to that, that is our main goal of this whole health disparity is to change the pregnancy complication rate in the United States. Therefore, for mothers to have a better survival rate. Thank you, and have a great day.